Hello and welcome to this week's episode of the show. On this week's show, we're going to be answering the question that so many of us have heard so many times over so many years in practice. How often has a patient said to you, "I've heard once you go to a chiropractor, you have to go forever"? Or they say, "I've watched what you do, doc, and it looks like when you're seeing me or anybody else, you're just doing the same thing to everybody." We're going to talk about that, how you answer it, and what to say and what not to say. Welcome to another episode of For the Love of Chiropractic. I'm your host, Dr. Robert Freeman. I've been in practice for over 30 years, and I continue to work in $1 million practice that I built, ran, and sold. I've taught, lectured, and coached our profession, and helped so many chiropractors build the practice and the life of their dreams. And now, I want to help you do the same. So here's today's show. So I am so excited to discuss these two questions with you on today's episode. But before I dig in, let me tell you a story. A week or so ago, I got a phone call from a friend of mine. He's actually the friend of a friend, but we've become friends along the way. And he said in a very respectful tone, "Robert, I mean no disrespect, but I gotta ask you a question. When I go to my chiropractor," because he's more convenient and they've known each other for a bunch of years, and that's terrific. They have a great relationship, and this other man is a great chiropractor also. "It seems like he does the same thing when he adjusts me, and I'm in the room when he adjusts my wife, and I'm in the room when they adjust our kids, and it looks like he's just doing the same thing to everybody, and I don't understand that. And frankly, I knew I could call you because I'm embarrassed to ask him about that." And then he went on to say, "And once you answer that, I have another question for you, but I'll hold off and ask you that one in a little while after you've answered this first one." And based on the title of today's episode and what I said in the introduction, you already know what that second question is, but we'll talk about that one in a few minutes. So the answer to that question of do you do the same thing to everybody, some chiropractors go with yes. I remove the vertebral subluxations, so I'm adjusting everybody, so of course I'm doing the same thing to everybody. And with 30 plus years of experience and having spoken to so many people and so many doctors over so many years, in my opinion, that is not the best or correct answer, period. Because that's not what people want to hear. The better answer, in fact, the best answer that I know of, is to begin by using an analogy. I love using analogies, and they work so well with people. Use something that they already know and understand. So the analogy that I like in this case is when you go to the dentist, it seems like the dentist does the same thing to everybody. The person gets in the chair and they open up their mouth and they stick their fingers in there and they poke around with some instruments and then, they scrape and do some other stuff and then it seems like they're done. And then when the next person gets in the chair, they're doing the same thing. But are they really doing the same thing? No. There's a certain procedure that they do. The dentist inspects each of the teeth in a certain way, looking for certain things on each of the teeth, and then moves on to the next tooth. When the dentist finds an issue with any one of the teeth, the dentist either takes note of it or takes care of it, and then moves on to the next one. If there are significant multiple issues with one or multiple teeth, the dentist informs the patient, we need to set up some additional visits to take care of this deep cavity, the root canal, the decaying tooth, the cracked tooth, whatever it is, and the person says, "Oh, okay, I understand." By using that analogy, you can go on to say, chiropractic is very similar. Everybody lays down on the table, yes, of course. The chiropractor inspects the spine, and we're looking for the misalignments, the subluxations. We're looking for the associated subluxation complex issues that go along with the subluxation complex, the muscle tone, the lack of elasticity of the ligaments. Perhaps there are trigger points there. The unequal movement of one side of the joint compared to the other, thinking about the sacroiliac joints in particular. Something as simple as testing range of motion, how far you can turn one way versus the other, tells us what's going on, and we add these things together so we know what we need to do. Now, of course, as the chiropractor, you know that. And it's child's play. It's easy. We do that all the time. Do it day in, day out, year in, year out, decade in, decade out, for a fantastic career and a lifetime of helping people. But to the person, they don't know that. And sometimes they go on to say, but you make it look so easy. I mean, it's not that hard. I'm paying all this money just for that, and you're so quick. Well, first of all, you're not buying my time. You're buying the expertise. And I think you want the procedure done as quickly and safely as possible. And the definition of a professional is they can take the difficult and make it look easy. And that's true in all professions. In fact, as a practicing chiropractor, if you've been in practice any amount of time, I'll bet you've taken care of middle school teachers, maybe even middle school math/algebra teachers. Now, why they would choose to do that, obviously they have a passion for it, but not only are they teaching algebra to these middle school kids, but they also control the classroom. Imagine trying to control a classroom of 30, 40, or maybe it's 50, I don't know how many exactly, students, and teach them a complex subject like algebra. You know what? You have to be a professional. You own what you're doing, you know how to do it, and you take them through the process, and they get it. That's terrific. As chiropractic physicians, yeah, we make it look easy. Oh yeah, you palpate the subluxation, you adjust it, you put the impulse in there, it moves, it cavitates, maybe there's an audible release, maybe there's not, and that doesn't matter. As long as we've reduced the subluxation, they're going to be getting better. You've removed the interference, and they will be improving. And to explain that to the person, that's what needs to be done. So yes, it may look like I'm doing the same thing to everybody, but I'm not. Even when I turn someone on their side, doing a side posture diversified technique, it looks like I'm doing the same thing. But did you know the exact placement of my hand and my fingers changes the way I'm adjusting? Just like when you're playing a violin or a guitar, the exact placement of the bow or your fingers on the fretboard and on the strings themselves changes the note that the instrument plays, which is very different. But it looks like you're just doing the same thing all the time. But you know the music is different because you have a different focus, creating a different outcome. That's what's different about every adjustment that the chiropractor does. And the man on the phone said to me, I respect that. That makes sense to me. You are the professional in this arena, so I accept that as truth, and that makes absolute sense to me, just like with what I do. And he went on to talk about what he does in his job and how it could look like he's doing the same thing all the time, but yet it's very different. And I said, exactly. And he said, but now I want to ask you another question. You know, it seems like that once I start going to the chiropractor, you know, that I keep going forever. And the guy keeps saying that I should bring the rest of my family and my parents. I should bring in, my neighbors. I should tell them. And I'm a little bit afraid to tell them to start going to him because it seems like I just have to keep going forever. And, I like him and it's, I go when I need to and it seems to help. So I do that. And he went on with a lot of other pleasantries that we've all heard patients say. But bottom line, he said, I don't understand why I have to keep going forever. And I would love to know what you say to that question. I'd also love to know what you say to the other question that we just discussed. And I invite you to leave comments on the website for theloveofchiropractic.com under comments. And then with permission, I'll even share those on a future episode. But to answer the question, once you start going, I heard you have to keep going forever. What do you say to that? Here's the best answer that I know to that, is to look them straight in the face and say, yes, it's called healthcare. I've heard once you go to a dentist, you have to keep going forever. Once you have an annual physical with a primary medical doctor, they want you to have an annual physical every year. You have to keep going forever. Once you go to the eye doctor and have your eyes checked, they want you to keep going forever and have your eyes checked every year. Once you go to a dermatologist and they do an annual skin check, they want you to go forever. They want you to come back every year just to have your skin checked. Yes, that's called healthcare. And sometimes the rest of that is, well, but I don't have to go there 3 times a week. Yeah, that's absolutely correct. You don't go to all those other places 3 times a week, and you won't be coming here 3 times a week for the rest of your life either. As you progress through care and your care gets stepped up to fewer visits each week, you'll get to a point where you are just doing checkup visits, and depending on exactly how you live your life, the activities that you do, depending on how much degeneration there is in your spine that is irreversible at this point, and depending on your exercise and flexibility, you'll end up with some sort of checkup schedule, and typically it's somewhere between once a week and once a month. Maybe it's once every 2 weeks, maybe it's once every 3 weeks, maybe it's once every 4 weeks. It depends on what you're doing, and the reason that's so important is because unlike some of these other things that we talked about, you're using your spine and putting stress on it, creating subluxations on a daily basis. You may eat a chocolate bar once a day. That would be a lot. And you brush your teeth twice a day, and you go to the dentist twice a year. Okay, but you're looking at your phone, you're staring down at an iPad, you're hunched over looking at a computer. How many hours every single day? Compared to the amount of exercise, stretching, and flexibility that you do, it doesn't balance out, but it does create vertebral subluxations, misalignments, which reduces the efficiency of the joint complex, puts pressure on the nerves, and reduces the neurobiomechanical integrity of your body. And if you want your body to last you the rest of your life, in an optimum manner, in an optimum fashion, so that when you get to be 70, 80, 90, maybe 100 plus years old, you're still walking, doing all the things you want to be doing in the way that you want to be doing them. You keep the system aligned and working as well as it possibly can be. As I'm doing this recording, I just had my oldest patient pass away at the age of 103. And what was so wonderful about her, she told me so many things over the years. Do you know her first chiropractor adjusted her when she was 14 years old? She'd been seeing a chiropractor since the age of 14. And when you looked at her x-rays, they were beautiful. There was minimal arthritic degeneration. And by the way, at age 100, she stopped driving. You know why? Because her daughter, who was about 80 years old, said, "Mom, I think you ought to stop driving at this point in your life." And she said, "All right, then I'll stop driving." And, so she would get a ride to the office, but she walked in just fine, and she did absolutely terrifically. One of the things that she used to say to me, that she taught me, was her very first chiropractor, a man by the name of Dr. Knightley, somewhere back in the 1920s, had said to her, "The chiropractor puts in place and nature takes care of the rest." I wrote it down on a Post-it. I have it in the office, and I've shared that with so many people, and now I've shared that with you. And I like to think that Dr. Knightley is smiling, looking down at us, knowing that chiropractic is still being practiced very similar to the way that he practiced a century ago, or almost a century ago. And armed with that story, maybe you'll have the fortitude to discuss with patients why they should bring their children in to see you. Well, why should they come and see me? They're not having neck pain or back pain. No, of course they don't. But we want to keep that young developing spine aligned so those nerves are working as close to 100% as possible. What percent would you like their nerves working, knowing that those nerves are controlling everything in the human body? In fact, that's one of my favorite questions to be asking people. We don't talk about pain. What percent do you want your nervous system working? And invariably, people always say, well, as good as possible, or as close to 100% as possible. Or they'll just say 100%, of course. That's why we need to be doing what we're doing. It's not about the pain. And having answered the gentleman's two questions about, it seems like you chiropractors do the same thing with everybody all the time. And the other question was, well, once you start going, do you really have to go forever? Having answered those two questions, again, I'm on the phone with him. He said, oh, you know what? I've taken up enough of your time and I really, really appreciate you explaining it to me. I'm going to go back and see my chiropractor and I'll continue to do what it is he said because now I understand it. And I said, you're welcome. Feel free to reach out to me anytime and I'm happy to help you any way I can. And as I hung up the phone, I sat and thought to myself, thank God that man felt comfortable enough to call me so I could share that information. And I also thought, isn't it a shame he didn't feel comfortable to ask his own chiropractor, someone he's known for years, and he trusts them, those same questions. How many of your patients are thinking the same thing and aren't asking you, don't know the answers, and just sort of wonder? And I think the answer is, it's a lot of the patients that you liked and have helped over the years and somehow found their way out of your office instead of sticking around for lifetime maintenance wellness care to help them live the best life possible. So as we close out today's episode, I'm going to urge you, think about those two questions that we've answered. Think about your answers and maybe use some of your answers in some of what I've said. And please leave me a comment on fortheloveofchiropractic.com because I would love to hear some of the things that you say to patients. And make a promise to yourself. Make a promise for the future of chiropractic that you'll start telling your patients why they should be adjusted for the rest of their life. All right, and that's our show for today. If you have a question about today's show or your own practice, feel free to reach out at fortheloveofchiropractic.com. Before making changes to your practice, be sure to seek legal advice regarding those changes and regulations in your state. For the Love of Chiropractic is an RGF production, all rights reserved. And thanks for listening. Original music provided by Hunter Rich Music.